Hi, today I'm joined by a urologist. Would you like to introduce yourself?
My name is Dr. Sagar.
Okay, cool. So, as a urologist, what do you do typically?
Sure. A urologist is a physician who specializes in the urinary system in both men and women. Not so much the function of the kidneys and making urine, but the plumbing of the kidneys and the bladder and that sort of urinary system. We do see patients in the office for problems urinating. We see patients in the office for cancer of the kidneys, of the bladder, anywhere in the urinary system. We also see patients for kidney stones. Part of our occupation involves performing surgery and procedures in the hospital in the operating room. So we will perform surgery on the kidneys, the kidney tubes, the bladder, for men, prostates. Some urologists will specialize in women who have problems urinating or incontinence, the leakage of urine.
Oh, wow, that's a lot of stuff.
It's a specialty, so luckily it's not too much stuff. And even within the specialty, you can focus on one aspect of that. Very few people now do all aspects of it. There are urologists who do additional training and learn how to treat women with voiding dysfunction, and basically that's their whole practice.
Oh,
I don't treat any women. I don't perform surgery on women with voiding dysfunction because I didn't get any extra training on that by choice.
oh, okay. How would you describe your typical day as a urologist then?
So urology involves both being in the office and in the operating room. On the days you're in the office, you see patients just like any other physician who does outpatient care. You have scheduled appointments. Sometimes you'll do procedures. We can look in someone's bladder in a few seconds right in the office with the equipment we have. We can do biopsies of men's prostates in the office. Men who want to have vasectomies, we can do that in the office as well. Now, we can also perform Botox injections in the bladder for both men and women who have overactive bladder issues.
Oh, wow, I didn't know that was a thing.
Recently, it's become a very good treatment for overactive bladder in both men and women.
Wow, that's so interesting. So, do you have any particular reason why you chose this career over any other?
Um, it Going through medical school, I really had no clue what I wanted to become. Um, and every specialty seemed pretty hard for me. But this one just seemed to make sense. It was easy for me to understand. And I like the idea of doing both office and procedures, both in the office and in the hospital, as well as surgery.
Oh, so um, other than liking doing surgeries and being in the office, what other likes and dislikes do you have about your job?
I think urology is more appealing to me because it's a gadget specialty, meaning we have a lot of gadgets. If you like playing video games, some of our surgery is very similar to that. When we treat a kidney stone, oftentimes we treat it with a telescope that goes up into the kidney or the kidney tube, and we have a laser to break up the stone and pull out the pieces. So it appeals to my affinity for video games, for one. And even some of the surgeries we do now, the bigger surgeries, are done with the assistance of a robot. And little instruments are put into the body through little incisions with a camera, and all those things are controlled by a robot. And you're still in the room, but you're sitting almost at like a desk, but we call it a console, and it's only meant to control the robot. But through that, you control all these little instruments in the camera, and you can do some major surgeries. There are actually a lot of people who think if you grow up playing video games, you're going to do better with this sort of robotic or laparoscopic type surgeries because you're used to that sort of hand-eye coordination.
Oh, wow, that's really interesting to hear about. Yeah. So, do you consider your job stressful? And if it is stressful in any way, how do you typically deal with that stress?
So there's different types of stresses, I think, in any job. The one thing that surprised me in not just my field of urology, but in the field of medicine, whether you're speaking about physicians, whether you're speaking about nurses, whether in the hospital or outside the hospital, whether you're speaking of physician's assistants, is there is a lot of bullying and a lot of academic, what we call snobbery, meaning looking down at someone else, or one physician thinks they can do everything better than the other. And that was the most surprising to me. I knew it existed, and then I assumed it would be worse in other fields, but I didn't think the medical field would be uh, so into that. Um, there are certain specialties, I think, where it's worse, and certain specialties where I think it's better. In general, pediatricians seem to be less apt to bully their peers or others. Um, so that's a field where you can work without a lot of that sort of peer pressure.
Oh. So, how do you deal with like people possibly looking down on you for stuff like that?
Well, you try to find a place where you don't have to deal with those people, and sometimes that means moving or finding different jobs within the same town. And it's challenging, it's difficult. I think it's there in in whether in every field, whether you're an accountant in a big accounting firm, whether you're a lawyer in a big law firm, whether you're in a business. I think that is there everywhere. I was just surprised to see how much there is in medicine. Maybe I was naive. I don't know.
Um, as a wrap-up question, what advice do you have for high schoolers who are interested in like a physician's job or even like going into urology?
Well, I think urology is just one specialty. If you happen to find it interesting while you're in medical school, that's great, and you can certainly pursue it. There are a lot of different areas you can specialize in. Um, it's a long residency, unfortunately, 5 years, sometimes longer if you do a fellowship. Um, in general, for medicine, it's one of those strange things. I mean, there are some people who know they want to go into medicine or nursing or uh, even become a pharmacist. They know this from an early age. There are other people who go through medical school and then at the end of it still don't know what they want to do and don't know if they made the right decision. And there are even people who go through a residency and when they're done, realize, wow, I don't know if this is for me. So I don't know if there's any advice I can give, but if you want to become a physician, I would tell you, speaking from personal experience, you don't have to be smart, but you have to be willing to work very hard and be dedicated and spend a lot of time studying and have a very long-term focus. It's a very long-term goal. Uh, as you know, you have to go to college first, and that can be 3 to 4 years, and then there's 4 years of med school, and the shortest residencies are another 3 years. So that's a long time to figure out whether at the end you're going to be happy or not. And I would tell you, if you do pursue that, my recommendation would be to try to major in something else besides just biology or chemistry in college, unless you know that if you change your mind, you'd be happy being a biologist or a chemist. Um, if I had to do it over again, I probably would have become an accounting major or a business major, still with the idea of going to medical school and taking the necessary courses to get there. I think it would have been nice to have been able to fall back on that should I at the end realized, yeah, this isn't for me.
Okay, thank you so much for having this
Sure.
interview with me.
Sure.
Thank you so much for watching this video, and I'll see you in the next one. Bye!